Some 15 million Americans may lose Medicaid coverage in the coming months due to pandemic-era protections expiring. That's according to the Department of Health and Human Services. It predicts more than 8 million will leave Medicaid due to the loss of eligibility. Nearly 7 million will lose coverage despite still being eligible due to administrative churning. That's when someone de-enrolls and re-enrolls within a certain time period. For more, including a definition of what that means, I'm joined by Daniel Tsai. He's the Deputy Administrator and Director of the Center for Medicaid and CHIP Services. Daniel, a lot of folks who might lose coverage have had it over the past 3 years. So how much will this affect their lives, and what would the timetable be in terms of losing coverage?
Well, thanks for having me, John. I think this is a very important topic. We've been out messaging. So during the COVID-19 pandemic, in exchange for receiving federal funding, states who run individual Medicaid programs were required to maintain everybody enrolled in Medicaid. And as a result, we've seen our Medicaid enrollment grow to 92 million people. Medicaid has been an important bedrock and a safety net piece of coverage to historically low uninsurance rates. Starting this month, April 1st, Congress has authorized states to begin that annual redetermination process for Medicaid eligibility. All states will be redetermining Medicaid eligibility over the next 12 months. So all 92 million people, and that actually includes 51% of kids in the country who are enrolled with us on Medicaid, will have to undergo a renewal process in the coming 12 months.
And so that in that process, if a person is on Medicaid, how do they find out whether they can stay on it, if they're going to fall off it? Is it possible? Is it state by state in terms of whether you lose Medicaid? Might there be a weaning period? How would that work out?
Yeah, and there are 56 different Medicaid programs in the country by state, by territory. As an administration, our priority is to keep people covered. That means keeping people covered on Medicaid if you're still eligible, making sure that everyone knows when they have a redetermination coming up. And that also means making sure folks who are no longer eligible for Medicaid get connected to other coverage. The vast majority of folks will have access to no premium or free health insurance through the marketplaces, health insurance marketplaces, or through employer-sponsored coverage. Everyone enrolled in Medicaid today is required, states are required to send a notice to you in order to inform folks of that they're actually undergoing a renewal, and for folks to respond on information. And so folks will get noticed. And our focus is also making sure that states are trying to do their best to really use other data sources so you can automatically undergo a renewal without having to respond to a piece of paper in the mail. Part of our message is right now, especially for folks that have moved, make sure your state Medicaid agency has your updated contact information.
So just to remind people, when you talk about marketplaces, you're talking about the federal system that was set up under the Affordable Care Act, right? And in addition to that, because this has got to be the last question, if those systems are in place, does that mean that this 15 million number might not actually be that big if people get the notices and follow the appropriate procedures?
So we'd love to minimize that number. There will be some of those individuals eligible for, you're right, the health insurance marketplace is healthcare.gov. There's a program running in each state. So many folks that will be over income for eligible will be eligible for highly subsidized coverage outside of Medicaid. We want to help get people there. For folks that remain eligible for Medicaid, we want to make sure folks update contact information, look out for a piece of paper in the mail, and successfully complete that renewal process.
All right, Daniel Tsai, thank you so much for being with us.
Thanks for having me.